How would you describe the New South Wales mental health system at the moment?
Broken.
I don't think we really have a system at all at the moment.
We've seen children presenting to emergency departments with mental health conditions more than ever before.
These psychiatrists want you to listen. Scores have resigned this year, shattered by the public mental health system in New South Wales.
One of our first principles is first do no harm. And when you feel you're in a situation where you have the potential to do harm, it's probably time to go.
Intolerable conditions have forced them into life or death choices.
He was walking around with a loaded nail gun in public. It's another Bondi junction waiting to happen.
I've been beat, I've been punched, I've been kicked, I've been spat on, verbally abused as well.
And people who need this system are stuck in a vicious cycle, in and out of hospital.
They said to me, we can't do anything because the beds everywhere were full. So they just had to send me home.
Australia is facing a national mental health problem. But New South Wales is at the bottom of the pack.
New South Wales has the lowest per capita funding in mental health care across all the states.
We've received an extraordinary number of leaks from within the New South Wales mental health system, uncovering a shocking deterioration of services the government doesn't want you to see. We know the system has been stretched for decades, but are we now witnessing the collapse of public mental health in the state?
Sitting at work, looking at the ED flowchart for patients coming in for Westmead and Blacktown. And we have patients that have been waiting in Westmead ED for 80 plus hours. We don't have the beds for them. There's nowhere for them to go.
So Tegan, you've got night shift tonight, right?
Yes, night shift. So generally we start our night shifts and we work from 9:30 p.m. all the way through to 7:30 a.m. We're awake the whole night.
Tegan Serena's bracing for her shift at the country's biggest mental health hospital.
Some night shifts I found can be incredibly difficult to manage and incredibly busy, and then other night shifts, not a lot really happens. It's determined by the acuity of the patients that we have in.
Tegan's worked on the front line of public mental health for 3 years in Cumberland and neighbouring Westmead hospitals in Western Sydney. Her job's become a lot harder with services shutting down around her.
We've seen an influx of patient presentations and an inability to provide bed spaces for them, leading to longer wait times in emergency departments. It's abysmal. It's ridiculous. Almost every single day I'm getting texts for overtime for people to come in and fill shifts because we don't have the resources and we don't have staff that are available to work in there. Sometimes even multiple times a day this is happening.
So these are all in Westmead Emergency?
These are all in Westmead Emergency in the mental health section.
Wow.
Like, it's constant, it's chronic.
Tegan, we're heading into a long weekend. What does that mean for your shift usually?
Admissions are happening at a rapid rate. So we're looking more like there's going to be some form of bed block. My hope is that it won't be that, that just won't be the case. But you can never really guarantee these things, unfortunately.
The Western Sydney Health District is among the largest in the country, capturing more than 1 million people, and it's growing.
I grew up in Western Sydney. I grew up with my family and my friends utilising the public health system. I work in public health because I want it to be better.
The department that runs this system, New South Wales Health, restricts staff from speaking openly about the medical system without approval. Tegan's speaking to us through her role as a union representative.
Tegan, it's a risk for you to talk to us today. I mean, what's pushed you to actually speak out?
I think there are faults in the system that need to be fixed. I think that's worth the risk. Drive straight through, Wetchin. There's Cumberland.
New South Wales Health did not allow us to film in any public hospital or mental health facility in the state.
Hi. How are you?
Tired.
How was your shift, Tegan?
There's a lot of the repeat presentations who have been discharged a little bit too early. We've got no beds for people to come from ED and be admitted into at this point.
How many psychiatrists were on?
One for the entirety of Cumberland Hospital overnight. So, like over 100 beds to one psychiatrist.
I go by Anu Kataria. I'm a consultant psychiatrist. I was, till a couple of months ago, an employee of New South Wales Health, located out of Cumberland Hospital in Western Sydney.
Consultant psychiatrists are specialists with critical expertise in mental health treatment.
It takes about 12 years minimum to become a psychiatrist, and because we're medical doctors, we can prescribe medications. I often think when people think about what a psychiatrist is, they probably imagine someone in a suit sitting in a fancy office talking to someone about their feelings. But that doesn't actually reflect a lot of what psychiatry is, particularly in the public system where we care for people with some of the most severe mental illnesses like schizophrenia, bipolar disorder, severe depression, people who might be at risk of harm to themselves or other people.
The people that we look after, especially in the public health system, are essentially voiceless. They are often people who don't have a lot of means, don't have a lot of support, and don't have a lot of understanding of what's happening to them.
Did you feel there was a pressure to discharge people before they were ready to leave?
Yes. We often would reach work and at 8:30 in the morning get a text message saying, the ED is backed up, Westmead ED is backed up, there's 15 people waiting, there's a dozen waiting at Blacktown, and we're the overflow hospital for Blacktown Hospital as well. Please discharge. It was real, it was constant, and pretty unrelenting.
Where were those messages coming from?
Can I say high up? High up. You know, whoever sits high up, I'm not sure. I mean, I can name the person or the post from where the messages actually came, but I suspect that they had people telling them what to do. When I was a very junior consultant, a senior consultant once asked me, Anu, what do you think your role in this hospital is? I said, all the things that I thought my job was. And he said, no, it's not. He said, your job is to keep the Minister for Health out of the newspaper. You will never do anything to embarrass the minister. And jam-packed emergency departments are an embarrassment to the government. Nobody wants to see a jam-packed ED. And so therefore the pressure slows all the way down. Get the patients out of the ED.
How does that feel for you as a doctor?
It feels pretty terrible. My patients are a lot unhappier. The pressure on me to not treat them fully is infinitely higher. The expectation from senior administration, from the executives, is that I just get people out as soon as I can.
Many people at emergency departments with a mental illness aren't there by choice. They've been scheduled under the Mental Health Act as a risk to themselves or others. At Westmead Hospital, they're often left waiting in a packed corridor, on chairs or on the floor, for one of just 6 dedicated mental health beds in the ED. We've seen internal figures showing how long people with serious mental illness are waiting to be treated in Westmead's emergency department. In March, a 19-year-old waited for more than 3 days. A 45-year-old woman with suicidal thoughts waited more than 2 days in April. Later that month, on one day, 2 men had been waiting more than 80 hours for treatment. And a man with schizoaffective disorder was waiting 93 hours. That's almost 4 days.
So when I walk into the ward on whatever day of the week it is, and there's somebody who's come to me who's been like that, waiting 4 days, they are probably worse off than when they first came through the door of the hospital, because they are not only unwell, they are now angry and confused.
We've been leaked these photos from November when a man in psychosis broke into Westmead's psychiatry ward for mothers and babies. It shows the severity of the cases Frontline staff are confronted with.
A lot of mentally ill people don't have that soothing environment. They end up self-soothing by using substances, using drugs, smoking cigarettes. There's an angry person and there's a hostile environment. It's either fight or flight. And so our patients fight. How do they fight? They fight by hitting out at the person closest to them, which is another patient or a staff member.
The Health District for Western Sydney says it strives to provide high-quality care to all mental health consumers in EDs. We're not meant to see what happens behind closed doors at New South Wales hospitals, but we've been leaked this vision. In April, this man who's been waiting hours in the Westmead emergency department tries to escape the hospital. Nurses and security try to stop him. Then he bites one of them.
I've been beat, I've been punched, I've been kicked, I've been spat on, verbally abused as well.
Security guards like Omar are tasked with managing the violence, sometimes with devastating consequences.
Patients would complain about the wait time. In their eyes, they probably saw it as no one cares.
In June last year, Omar was stabbed by a mental health patient who'd been waiting in Westmead's ED and was about to be sedated.
As soon as he saw the needle, he pretty much stood up from the bed, jumped pretty much on my back, pulled a knife out of his jacket and stabbed me in the neck. Initially, I thought I was gonna die. When the nurse grabbed me and she was actually running, I thought, this is really bad.
And how long had he been waiting in emergency?
So from my knowledge, he had been there for, I think, over 12 hours.
The man who stabbed Omar has pleaded guilty to 4 offences. The crisis in mental health has been growing for years, and the New South Wales government has been well aware of it.
So I'm Dr. Pramuthi Gunaratna. I'm the New South Wales Chair for the Royal Australian and New Zealand College of Psychiatrists. The college is the peak organisation that looks after all the psychiatrists in Australia and New Zealand. We received letters from clinical directors, so these are people who run mental health services in New South Wales, telling us that they are not able to recruit staff, they're not able to keep staff, and so they were really just rapidly losing psychiatrists from the public sector.
In October 2023, psychiatrists wrote to the government requesting an urgent meeting, saying mental health care was under existential threat because the workforce was shrinking and demoralised. It took almost 4 months for the ministers in charge to meet with them.
Unfortunately, we just haven't really had any traction with the government. There's no plan that the government has been able to articulate in terms of keeping staff, in terms of recruiting new staff.
Psychiatrists asked the New South Wales government for a 25% pay rise. After 15 months of negotiations, the government refused. So in January, a stunning number, more than 200 psychiatrists, announced they would resign from their permanent positions in the public system.
29th January 2025. I have worked with this local health district for over 22 years and had imagined that I would do so till I was ready to retire in another decade or so. However, despite a deep sadness at this decision, I can see no other way to be true to myself and the people that I have been entrusted the care of.
Many of those who resigned were the most experienced psychiatrists in the state.
It's like from a village getting rid of all the grandparents at the same time. So there's the parents who may be able to look after the kids, but the wisdom that comes with being a grandparent is gone.
So, just had a call from Leah, worried about the nurses poisoning her and some other person that's come in today, doing some other stuff to her. Bit worried.
I was excited last night. I found it a little bit difficult to get to sleep because I was thinking, oh, what have I got to do, what have I got to organise in the morning. And I say, oh, we'll take it.
This is Lee's first cigarette with her sister and niece in a while.
It's not a bad thing for keeping you calm and that, isn't it? When you're stressed, it's not a bad thing, is it?
No, they should give it to everyone in hospital.
She looks well, actually.
Yeah. We've been lucky.
The 49-year-old has been staying in one of Liverpool Hospital's mental health wards.
What do you want to do? Do you want to go for a wander?
Lee, she's funny. She's got a great sense of humour. She's clever. Yeah, she's very smart.
Chantel says the system's failed Lee. Like many others, she's been repeatedly discharged well before she's ready, resulting in a cycle of quick deterioration and readmission.
Yeah, it's all about beds. And so I think once they get her to a point where she's taking her meds and it's good enough, they discharge. You just kind of wait for a critical event and then she gets brought back in. I think it's been about 19 schedulalisations, up to 25, but she's had 9 in the last 2 years. The last few years have been pretty bad. So every time she gets scheduled, we lose a little bit of her. And so that's why I'm angry with them, because they don't actually understand the impact it has.
I brought your guitars and your bongo drums too.
Bongos. They're haunted, darling. How you do that?
What mental illness does Lee have?
Initially it was schizoaffective disorder, and so that is she sees and hears, she has auditory delusions, she has visual delusions. So over the last 25 years, the meds have stopped working, and so now they call her treatment resistant.
Liverpool Hospital says it offers a range of therapeutic services tailored to meet individual needs. Chantel says that wasn't Lee's experience.
She sees a psychiatrist maybe once a week. They medicate her, that's really it. There's Auntie Lee there, and that was my nonna, her mum, and me.
So cute. So there's no therapies, no talking to someone, anything like that?
No. It's very much medication regime based and then discharge. I'm sure it's resources. I see the amount of people that come in and out.
This is Chantel's idea. It's worth a fortune. I'm overwhelmed. I've got a sister and a niece who actually helped me put everything together.
It's been a constant battle for Chantel to be consulted about her auntie's care.
Look, I call a lot and I do harass a lot. And this time they had to listen to me, which is very different from previous times.
Today, they're heading down the New South Wales coast to see the unit Lee will be living in when she's discharged in a couple of weeks.
Because they were for damn near transit.
They are not. I don't know. I'm going to park this way only because we're going to get all the stuff out of your car as well. So let me just...
Yeah. No, the bottom opens and the deadlock.
There you go.
Oh, wow. How pretty, Luana.
Well, it's
Oh my God, why did you do this?
There's things to be done, but
Okay.
that'll go there and the fridge will go there. Come and have a look at your lovely bed.
We'll work it out. Come and look at the bed. Let's go.
Is this you?
That's when she was in the army. She was in the she was in the Army Reserve for a couple of years. Yeah.
Leah's mental health stems from trauma. I think there's a lot of underlying causes that have triggered her and still trigger her at the moment.
Lee knows she's fortunate to have a place to live. Many who are discharged have nowhere to go.
What could help
I think
people?
At least 6 months accommodation offered for sure. Okay, and that can give them the time to build up bond and clothing and transport and mobile, so that they could build up the support services. And after 6 months, then they get transported to where they've got to go next.
So, Lee, how are you feeling about staying here tonight?
I'm right. I'm right. Give me a hug, I'm so happy.
This is the first time Lee will be living alone in 15 years.
Lee was so social and had all these friends, and she's vibrant and she's beautiful, and she lost all that. So, sorry, can we stop for a sec? That's okay. She could have lived a functioning life if we would have done something 20 years ago, and they keep bringing her in and letting her go, and each time her relapses are worse. Each time she can get more aggressive, she's either going to get hurt, someone else is going to get hurt, and then as family you have to sit back and wonder, like, what is going to happen? And it's a scary thought.
We reached out to our audience to hear your experience of getting help for serious mental illness in New South Wales. We were flooded with responses. We've protected the identity of these people for the privacy of their loved ones.
My daughter is kind and smart and she's very creative.
My brother Luke was an introvert, gentle and creative. Luke had self-presented multiple times with suicide ideation and a plan. This should have been a major alarm.
The day before her final discharge from the psych ward, she said to me, "I can't wait to get out of here so I can kill myself." I told the doctors exactly what she had said, but they discharged her the next day.
In my daughter's most recent admission to a Sydney hospital, she was again discharged without further direction provided for her care. As soon as she got home that afternoon from being discharged, she went to her room and attempted suicide. We later found out that the trigger for this suicide attempt was despair, her despair at being sent home again.
Twice, I pleaded with them to admit her, explained how unwell she was each time she was discharged after a few hours. And days later, she was dead.
After he died, a serious adverse investigation was held, identifying multiple systemic failures that contributed to Luke ultimately taking his own life.
There were a sea of red flags that were ignored, overlooked or minimised. Alice was a beautiful, kind and caring person who could have lived a long, happy and productive life with the right treatment and help.
Luke, like so many others, deserved better.
The New South Wales government acknowledges the system is in need of improvement and reform, but it has zeroed in on the psychiatrist resignations, framing it as an unreasonable pay grab.
Their solution to this challenge is a 25% wage increase in a single year. That's not something the government is able to agree to. We have to think about the broad, not just mental health system, but overall state budget.
Well, I appreciate that doctors, earn more than the average wage, but what we're talking about is how do we recruit and retain senior doctors in the current environment that we're in.
And we are confident that could be done.
Even with a 25% pay rise, first-year psychiatrists in New South Wales would still be among the lowest paid in the country.
Thank you.
There's a lot of money to be made in private practice, much, much more than the public system could ever offer. For most doctors, I would say for every doctor in the public system, greed is not a driver. It's a passion and a belief in what you do.
Even before the resignations, New South Wales Health has been covering shortages with temporary staff, called locums and visiting medical officers or VMOs, on high rates.
So VMOs do have a higher cost as premium labour, although they also don't have access to various leave and other superannuation arrangements.
The government's own figures show a 25% pay increase for psychiatrists would cost around $30 million each year. The government won't tell us how much it's spent on temporary staff since the resignations, but job ads for locum positions show rates of more than $3,000 a day.
The government, on the one hand, is willing to spend exorbitant amounts of money to get less quality care, to get contract labour, but then in the same hand, they're saying that they can't afford to provide an allowance to recruit and retain permanent staff. So it really doesn't make sense that they can't afford to do this.
In response to the pay request, the government proposed a 6-month efficiency trial, followed by a counter pay rise offer.
We have put our own proposition on the table, and my view is that it's really reasonable. It is not just the 4.5% increase that we've already paid, it's 10.5% over the next 3 years.
Ministers and psychiatrists were deadlocked, and the New South Wales government referred the case to the referee for workplace disputes.
We are urgently seeking the intervention of the Industrial Relations Commission to resolve that. And Dr Murray Wright, the Chief Psychiatrist.
Four Corners offered the New South Wales Mental Health Minister Rose Jackson numerous opportunities to be a part of this story. She refused. The department put up the state's most senior mental health bureaucrat, Chief Psychiatrist Dr Murray Wright. Contrary to the government's position, he revealed to us he does support the 25% pay rise.
I am sympathetic to the issues that they raise, and I think in particular the disparity in wages between New South Wales and other states.
So are you supportive of that pay rise?
Yes.
The problems are also endemic at Sydney's largest hospital, the Royal Prince Alfred, or RPA. In her decade there, Dr Susie Goodison worked across the hospital, including the emergency department.
There were people who I remember being discharged and they'd be back in the emergency department the next day. It's pretty awful and demoralising, and I think it wears you down, and it felt hopeless at times. There were times when I thought, what am I actually doing for this patient?
Dr. Goodison was part of the consultant liaison team, which was overloaded. Last year, the equivalent team at nearby Concord Hospital reached dangerously low staffing levels.
The executive at that time determined that the clinicians that were at RPA would simply be able to also cover Concord. And I was away at Concord, there was nobody covering the service areas I was meant to be covering at RPA. It was just another red flag in the system which I could see was breaking down.
Dr. Goodison's cases in her final days as a public psychiatrist still weigh on her. She recalls a man with schizophrenia who'd been missing for months after being released from jail.
And he came in to RPA, to the emergency department, with a nail gun. And he had shot nails actually into his knees because the voices were telling him to do that. And so I immediately flagged that this man needed significant amount of care. He needed a bed in an acute sort of mental health unit, and that I was very concerned about him being in the general hospital. I then went off on a weekend, and when I called on the Monday, he'd absconded from the ward, the hospital ward, and no one knew where he was. He had no fixed address, and I don't know what happened to him.
So could he still be out there in the community in that current state?
Yeah. He was walking around with a loaded nail gun in public. These are the risks that we carry when we work in this field, and when I can't deliver that care to keep either individuals safe or the community safe. And the care needs to be, it's another Bondi Junction waiting to happen.
The job had become untenable. Dr. Goodison resigned with the other psychiatrists in January.
It's been a very difficult time for me to try and reconcile the choices that I made to work in the public, and then the choices I've made to leave. And I have thought, am I just making this worse? Am I making the system worse? Am I abandoning the system? But that boat is going down, and I realised that I was burning out, and there was a very strong sense of moral injury about how did I end up here, and I just couldn't keep walking on by and pretending that this was normal and that we were delivering care that was adequate.
After dealing with an overwhelmed hospital system, patients are supposed to be assigned to a mental health team in the community. They're meant to be staffed with psychologists, social workers, nurses, and ideally psychiatrists.
My name's Helen, and I'm a nurse practitioner in community and outpatient mental health. The volume of referrals that come through the mental health system has increased so much that sometimes it's essentially firefighting. We cannot provide the care that we want to provide to patients.
New South Wales Health told us it's investing more than $2.9 billion into mental health services, including funding for community care, like $102 million for living support programs, which reduce pressure on EDs. But the government's own data shows it's likely almost 60,000 people with severe mental illness aren't getting the community care they need. In the Sydney Local Health District, we've been told a community crisis team for the most severe patients is down by 8 staff. And there's now only one part-time psychiatrist for around 130 patients.
I think we're past the point where just funding new services is going to fix the problem. We need to invest in existing frontline mental health services. Because where are you going to staff? Who's going to staff these community centres when we're already struggling to recruit and retain staff?
In the first half of 2024, our son was admitted 3 times to the emergency department. Then in July, experiencing distress and not wanting to go back to the emergency department, he called the acute care community team and asked for help.
My son is loyal, confused and vulnerable. Over the years when he's been psychotic, we've been to the emergency department so many times at Sydney hospitals. I've begged, cried and pleaded with these doctors to admit him so that he could be stabilised.
My daughter is 14 and she's suffered from severe mental health issues for years. After taking her to emergency at one Sydney hospital and waiting for 4 hours, we were told there was no mental health support available and no beds. She was sent home for community care. It's been 4 weeks and still no psychiatrist appointment.
He put me on the phone to the member of the acute care team who told me that they did not have anyone available to speak with him or come and see him.
Due to a lack of ongoing mental health support, he has now spent a significant amount of time in custody over the years, and with each custodial sentence, his mental health has been exponentially worse upon release.
Our son died late last year, aged 19. He was a beautiful, clever, thoughtful, compassionate, perceptive, loved, loving and profoundly sensitive child and adolescent who had struggled with courage and resilience.
New South Wales Health told us patients are not discharged if it's not clinically appropriate, adding, "We will never turn people away."
I have depression and PTSD, and I've accessed mental health support since I was 13.
Let's stop Blacktown.
Carly Richardson is 20 and has had multiple mental health admissions. She's part of what's known as the missing middle, too sick for a GP to treat, but not sick enough to go to hospital.
I tried to go to my treatment team and look, please, I need more help than this. And they once again said, we can't, there's nothing there.
Without proper support, these people can end up in crisis care.
I think it was by the end of December, New Year's, I essentially was hospitalised. I was sectioned for harming myself and placed in a psych ward. And I had a suicide attempt in the ward, and I was saying, like, look, I'm not okay, you know, like nothing had changed for me. And they said to me, they're like, we can't do anything because the beds everywhere were full. So they just had to send me home, essentially. Once I got out, I didn't even make it home before I was sectioned again by 6 police officers and brought back to the emergency department after trying to harm myself again. And once again, I was like sent home just 10 hours later. After I was discharged, I was kind of referred back to the same community mental health team, which for months I was declining under.
One of the few options Carly has for her recovery is this safe haven clinic, part of the government's Towards Zero Suicides initiatives. But it's not set up for her complex needs.
The safe haven's great. It's definitely not a place that fixes me, but it kind of ties me over a bit. When I'm really not okay, I think we need more more services that offer that step up, step down approach. I've lost faith in the system entirely. When you suffer from mental illness, it is so exhausting getting up every day, trying to live alongside a brain that doesn't want you to be there. It's like, I'm so tired of just screaming out for help and nothing is there.
For the first time, we can share the results of a national landmark survey by Beyond Blue. It's the most up-to-date data in Australia today. It shows rates of severe mental health symptoms are rising. Now, more than 4.5 million Australians are experiencing a serious mental health challenge, but more than half of them aren't getting the help they need when they need it.
My name's James Lawler. I'm a child and adolescent psychiatrist. I work in a few sites across Western Sydney, and I'm a counsellor for the Australian Medical Association in New South Wales.
One of the most concerning problems we've found is the mental health system struggles to care for vulnerable children.
We know that 50% of mental health conditions present in children before they turn 14, and so there's always the hope and the opportunity that by intervening early in a child's life, you're able to improve the life course and the mental health, but also the broader health of a human being for many years. But where that intervention happens too late, I suppose you miss the boat.
Can you tell me about your workload?
Yes, it was triple the normal workload. It was the job of 3 psychiatrists that I was doing in one. So you sort of left with the option of either just continuing to provide care that you don't think is at a good standard, or trying to speak up and change the system.
We've uncovered critical shortages of beds in child and adolescent units across New South Wales. In Campbelltown's adolescent unit, 8 new beds built over a year ago have never been opened. The hospital says it has enough beds for the community's needs. In Concord Hospital's Walker unit, just over half of its 11 beds are available. And last week, the adolescent unit in the regional city Orange was forced to close temporarily when its only psychiatrist went on leave.
In one of the services that I work in, there used to be 8 child psychiatrists doing the work, and now there's 4. And, there's been a lot of efforts to try and hire more, but we can't seem to get any more at the moment.
Dr. Lawler resigned with his colleagues in January. He later decided to go back on a temporary contract.
Again, it's a really hard decision. I don't know if I made the right one. Stuck between wanting to improve the system, knowing that coming back and supporting a system that's falling apart sort of undermines the cause, but also not wanting the people who are left in the system to be struggling even more, and for children and families to be left without anyone who can help. If the government comes up with a strategy that brings people back, brings psychiatrists back to the public system, I'm all for it.
Dr. New South Wales spends the lowest per capita on mental health of any state or territory. As the state's chief psychiatrist, does that concern you?
Yes, I would like us to be at the top of that league table, not at the bottom.
Doctor, considering that the minister is the one who has that decision-making power, do you think that she should have spoken to us today about some of these issues, considering the severity of them?
That's a matter for the minister.
New South Wales Health says its system is among the best in the world, telling us if anyone needs mental health treatment, they should reach out for help. The Industrial Relations Commission is still considering a pay rise for psychiatrists. 62 psychiatrists have gone through with their resignations. Others are waiting for that decision.
We still have no tangible action from our government. So it really, I have no idea. What will it take for this government to take mental health care seriously in this state?
Being a doctor at Cumberland Hospital has defined me, a large part of me, for the past 2 decades. And so a big part of me has been taken away. And it's probably never going to come back. I wish things had gotten better and I had been able to stay where I was, but that's not to be.
I'd like there to be an incredible systemic change. There needs to be better resources. We need more staff. We need more nursing staff. We need better community resources. My patients deserve better. My colleagues deserve better. I deserve better.
I kind of built a website. I just wanted there to be kind of like a platform for, patients, their families, people working within the health sector to just be heard and to force the government to actually listen and respond.
So we're excited because we're not going back in, are we?
No, no.
But anyway, it's day one of freedom, yeah? All right, we can say bye.
Ciao.
Ciao. Yeah.
If you are in a life-threatening situation, please call 000. If you need specialist mental health care, there is 24-hour help available. You can call the New South Wales Mental Health Line and the New South Wales Transcultural Mental Health Line. Support is also available across the country via Lifeline, Beyond Blue, Kids Helpline, the Suicide Callback Service and 13 Yarn.